So I just got my PSA results in, along with my testosterone count. It was enlightening, to say the least. Not only was my PSA at a low of 3.84, but my testosterone came in at a youthful 785. This points to the fact that the cancer seems to not be castrate sensitive anymore. This is only due to the high dose PC spec over a 14-year dedication that only a few have done through my 15-year experience. I am once again celebrating this true victory. Anyway, enjoy this video I have for you this week, and as always, stay strong.
In the UK, 150 men are diagnosed with prostate cancer every single day, making it the most common cancer in men. So chances are you know someone who's been affected by prostate cancer. And given the disease is often silent, in other words, doesn't cause any symptoms, it does raise the question and the possibility. Could you have it too right now? And it's that little seed of doubt that brings men to my consulting room on a daily basis. I'm a GP, and every day I counsel men on the health of their prostates. And today I'm going to share the advice I give them with you. And by the end of today's video, you'll see why the decision to have a PSA test is such an important one. You'll also have a much better idea about whether having a PSA test is right for you. And I'll also share the decision that most of my patients make after we talk about PSA. So if you understand a little bit about PSA, you'll quickly see its advantages and its disadvantages. So PSA is a protein that's in each and every one of our prostate cells, and small amounts naturally leak normally into the bloodstream. And this is why we can pick it up on a simple blood test. Now, if we think of what might raise the levels of the PSA, well, let's say that those prostate cells were dividing and multiplying out of control, which is essentially a description for cancer, then naturally more cells, more division, more PSA in the blood. So it makes it sound like we've got a pretty good test for prostate cancer there. Now, if it were that easy, I wouldn't be making this video. But before I tell you who should be getting it and what my patients say, let's have a look at the good and the bad first. So as I said, more prostate cells equals more PSA in the blood. But here's the catch. Bigger prostate cells and damaged prostate cells also release higher levels of PSA into the blood. So it's not just cancer that raises this level. Other conditions like BPH, which is the natural enlargement of the prostate as it gets bigger, prostatitis, which is an infection and inflammation of the prostate, or even riding a bike or other forms of vigorous physical exercise can all raise your PSA level, which makes the following crucial to understand. A high PSA does not mean you have prostate cancer, and in fact 3/4 of men with a high PSA don't have prostate cancer. And then there's the flip side. What if you have a negative test? Can you be reassured that you don't have prostate cancer? Well, largely yes, but there is a 15% chance that you still have prostate cancer even though you've got a negative PSA. So it's not straightforward at all. So for my patients, I like to paint a picture, tell a story of the different paths you might go down if you decide to get a PSA test. So to start at the start, there are two categories of men. There are men who have symptoms that might be due to prostate cancer. These are symptoms related to the plumbing, like getting up a lot at night to go wee, or having a poor stream, dribbling at the end, or struggling to empty the bladder. And for these men, the decision is easy. Yes, you should have a PSA. And then there are the second group of men. These men don't have symptoms, but they're worried for one reason or another. Like maybe you've got a buddy who is diagnosed with prostate cancer. Maybe there's something in the news that's raising awareness. Maybe dad had prostate cancer when he was my age. Or maybe you're like a 60-year-old man, Mr. Bloggs, that I saw recently, who came in to see me purely because his wife was worried. This is the potential journey for one of those men. So for Mr. Bloggs that I saw, he ended up having his PSA test, and one outcome is that it's negative. And if it's negative, happy days mainly, because you can be 85% certain that you do not have prostate cancer. 85% certain. And then of course there is the chance that the test is actually positive. And for these men, you can be about 75% confident that you probably don't have prostate cancer. But these men need to be investigated and have this looked into. And so starts the potential emotional roller coaster, because what usually happens is these men get referred to a urologist. They'll probably have an MRI, maybe they'll have a biopsy, ending up with two outcomes. One of them, normal, happy days. One of them, cancer. And if it's cancer, well, it could be an aggressive form of cancer, bad news, but you'll be glad that you did the test and you picked it up early so you can start aggressive treatment right away. Or It could be a slow-growing type of cancer, the type of cancer that is never going to cause you any trouble for the rest of your life, and may have been best just left alone all along. So essentially the benefit of the test is either getting reassurance from a negative test or picking up an aggressive cancer early on. The downside of the test is missing a cancer even with a negative test, or going down the emotional rabbit hole of unnecessary investigations. So what do my patients say to me? Well, to be honest, most of them, not all of them, but most of them do decide to still go ahead and have the PSA test because they see more positives to having the test than negatives. But as I said, not all of them, and it is a personal decision based on your personal situation, and it's tricky, it's complicated.
And yes, it is true that PC-SPAS is the only prostate supplement ever tested in human studies for its efficacy against prostate cancer that resulted in programmed cancer cell death in all of the studies.
Bottom line is, you can make this journey a whole lot easier with less worry and aggravation just by using proven PC-SPAS in your protocol. It's the only supplement tested against prostate cancer cells. AD resulted in programmed cell death in 6 human studies, and you can't dispute that.
PC-SPAS lowered my PSA from 23 to 4 in 3 months.